Alzheimer's. Chances are you've heard that word before. Maybe it's touched your family or a friend's family. It can feel like this huge, complex thing. But you know what? Understanding it is the very first step. So let's break it down together and really demystify what's going on.
Okay, so just how big of a deal is Alzheimer's? Well, this number, it kind of says it all. We're talking 60 to 80% of all dementia cases. That's huge. So it's not just one type of dementia among many, it's the main one, by a long shot.
All right, so what exactly is it? At its core, Alzheimer's is a progressive brain condition. And that word progressive is so important. It means, unfortunately, that it gets worse over time, affecting memory, thinking, just cognitive function. And the name? It comes from a doctor, Alois Alzheimer, who way back in 1906 was the first person to actually describe these unique plaques and tangles he saw in a patient's brain.
Okay, this is something that trips a lot of people up, so let's clear it up right now. Think of dementia as this big umbrella term. It covers a whole bunch of conditions that cause cognitive loss. Under that umbrella, you've got different specific diseases, right? And Alzheimer's, well, it's the most common one. So here's the key takeaway. Everyone with Alzheimer's has dementia, but not everyone with dementia has Alzheimer's. Make sense?
All right, so because this is a progressive journey, it's really helpful to break it down into the three main stages. So it all starts with what's called the mild stage. This is where you first start to see symptoms that, get in the way of daily life. People can often still live pretty independently, but things are starting to change. And what's happening here is way more than just, forgetting where you put your keys. We're talking about things taking a lot longer to do, struggling with stuff like managing money, maybe even wandering and getting lost. And the personality shifts, that can be really tough. Someone might get upset or angry much more easily, and it's confusing for them and for everyone around them. From there, we move into the moderate stage. This is usually the longest part of the journey. And what's happening is that the damage in the brain is spreading out. It's hitting the parts that control language, our ability to reason, even how we process what we see and hear. At this point, the need for care really starts to ramp up.
And you can see how things really escalate here. The memory loss gets much more serious. And this part is just heartbreaking. A person might not recognize their own family or close friends. Learning anything new is pretty much impossible. And you might see some impulsive behavior, just because the brain's control center isn't working right anymore.
And finally, there's the severe stage. At this point, the disease has really taken a toll on the entire brain. Individuals become completely dependent on other people for everything. What's physically happening is that those plaques and tangles we mentioned are everywhere, and the brain tissue has literally shrunk. That physical damage is what leads to the loss of communication. It's why they need 24/7 care and why eventually they can lose the ability to move and become bedbound.
Okay, so we've walked through the stages from the outside. Now, let's go deeper and look inside the brain to really understand the causes and the risks.
This really gets right to the heart of it. Alzheimer's is, at its most basic level, a disease where brain cells, neurons, are dying off. And as they die, that whole incredible network of connections that lets us think and remember and live, it just starts to fall apart. So what's behind all this destruction? Well, scientists have zeroed in on two main culprits. First up, you have plaques. These are these sticky clumps of a protein called beta-amyloid, and they build up between the brain cells, basically gumming up the works and blocking communication. Then you have tangles. These are made of a different protein, tau, and they build up inside the cells, wrecking their transport system from within and killing them.
Now, when we talk about risk factors, it's kind of like a tale of two sides. On one side, you have the stuff you just can't change. We're talking about age, your genetics, your family history. That's just the hand you're dealt. But, and this is the really hopeful part, on the other side, you have things you can control. These are the modifiable risks, lifestyle choices about things like smoking, your heart health, your weight, things we can actually do something about.
So that brings us to the path forward. How do we even diagnose this, and what do the treatments look like today?
There's no single, simple test for Alzheimer's. It's more like detective work. Doctors use a whole bunch of tools. They'll do tests to check memory and thinking skills. They'll check neurological stuff like your balance and reflexes. They'll run blood or urine tests to rule other things out. And often, they'll do brain scans like a CT or an MRI to actually look for physical signs of change in the brain.
Okay, so for treatment, doctors are really aiming at two different things. The first approach is about treating the symptoms. There are drugs that can help with memory loss and confusion, and they can provide some real relief for a while. But the second approach, this is where things get really exciting. These are the newer disease-modifying drugs that are designed to attack the disease itself and actually slow it down. In this chart, this shows you what that progress looks like in real numbers. Now, we're not at a cure yet, but look at this. These new drugs are actually slowing down the cognitive decline by 25%, by 32% compared to a placebo. For the first time ever, we have treatments that can change the course of the disease. That is a massive step forward.
And all of this leads us to our final section, looking ahead. As we learn more and more, the whole conversation is shifting towards prevention and towards a real sense of hope.
So, what can you do? Where do we go from here? Well, the evidence is pointing pretty strongly to these key things: getting regular aerobic exercise, eating a healthy diet, keeping your brain busy with new challenges, managing other health conditions. It all makes a difference. You've heard it before, but it's so true. What's good for your heart is good for your brain.
And that leaves us with one last big question to think about. We've seen how tough this journey can be, but we've also seen the amazing scientific progress being made. It really makes you wonder, as we get better and better at this, could prevention actually become the ultimate cure? Could we stop this disease before it even starts?